I think, Sam, that we can begin. Good afternoon, ladies and gentlemen. Welcome to the Center for Biosecurity Studies, our Caribbean Air Pollution Initiative. And we want to welcome all of those from around the world who have taken time to join us this afternoon as we come to learn more about air pollution in the Caribbean, the monitoring that's being done in the different Caribbean countries. So we have a very distinguished panel of practitioners from around the region. We have Mrs. Tashana Redmond from Guyana. We also have Miss Jiselle Joseph from Trinidad and Tobago. We have Dr. Andrea Seeley from the Caribbean Institute for Meteorology and Hydrology. And we have also Miss Leanda Chapman from right here in Barbados. So we have a very interesting lineup this afternoon, ladies and gentlemen. And before we get into the presentations, I would just like to give a brief synopsis of the Caribbean air pollution proposal. And if you just bear with me as I begin to share my screen. This is the Caribbean Air Pollution Initiative. They are the I Can't Breathe Initiative, brought to you by the Center for Biosecurity Studies at the University of the West Indies. And we do have a document that we can share with all of those who are on the call this afternoon, and we can email that off to you if you would so desire. And this has a lot more details surrounding the actual initiative. But there are four main goals and objectives of this initiative: to establish the baseline levels of air pollution with the use of fixed site, and remote monitoring. Also standardization of safe air pollutant levels for the Caribbean, and also to develop a regional database that we can use to facilitate the sharing of data, incorporation of the Internet of Things, where we can use this data for our everyday lives that would help to improve our health, and also regional data analysis, forming a platform that we can share so that we can learn together and also grow together. And in that way, we would establish the Center for Biosecurity Studies as a regional hub, knowledge hub for air pollution in the actual region. So there are a few policies with respect to Barbados that are quite important. The first is the Barbados National Energy Policy for 2019 to 2030, which simply is trying to state that Barbados is going to try to achieve a 100% renewable energy and carbon neutrality for Barbados by the year 2030. It is ambitious, but it's quite achievable, but we have to do a lot of legwork to be able to satisfy this particular goal. There's also the Clean and Green Barbados initiative, which drives sustainability, leads to environmental protection and beautification. There's also the Bridgetown Declaration, which was signed in Barbados by a number of ministers of environment from around the Latin America and the Caribbean region, which is strongly urging a green and sustainable post-COVID-19 economic recovery so that we can have resilience and improve our health and protect our valuable ecosystems and environments here in the region. And there's also the big global initiative, the Paris Climate Accord or Agreement, where each nation has agreed on their national determined contributions or NDCs with the aim to limit greenhouse gas emissions to no more than 1.5 degrees Celsius rise by 2030. And so this is to frame the discussion that we will have this afternoon. And who are the most impacted by air pollution? This would include children, and this would include women, and also outdoor workers, as according to the World Health Organization estimates. And within the Caribbean, we have a litany of sources of air pollutants from Sahara dust, which we are quite familiar with, also vehicular pollution, and of recent volcanic eruptions and the ash that is spewed from erupting volcanoes. We also have, especially during the dry season, grass and sugarcane fires. If we are so unfortunate to live in areas where there are vast fields of these canes and they do become ignited, it can create quite a breathing hazard. Also, the indiscriminate open burning of refuse and garbage, because across the region we do have a challenge as it relates to solid waste management across the region. Thankfully, we've made some strides where smoking is concerned, so that is less of a problem at the moment. But we also still have industrial pollution, and there's also the intermittent challenges with mosquito control with the fogging exercises. And so there are a number of things that we are proposing to do within this proposal, one of which within Barbados is to try to develop a network of remote sensors. And this is in collaboration with the Department of Mathematics, Computer Science, and Physics. They have already been doing some wonderful work looking at the levels of sulfur dioxide within the air. And this relates to the traffic we would experience in the Bridgetown Harbor with a lot of the cruise ships that come to the island. And they're monitoring this at the Usain Bolt Athletic Stadium. So this is very interesting. And what this allows us to do, rather than having fixed site monitoring only, we can have remote sensors that can be placed around the island that would allow us to gather more data. And some of the proposed sites would be the University of the West Indies, also in the Warrens area, and also aboard the public transportation, and including buses, some of the electric buses, and some of the other public transportation. Also close to the airport. And we cannot also forget Ragged Point Lighthouse, which would serve as a 0 point in terms of the level of air pollution, or air pollutants rather, that are generated on the island. Also, what we want to do is to examine the Caribbean air pollution legislation across the region, to examine it critically and look for gaps and deficiencies that would enable us to address the level of awareness and also the level of enforcement within the region. Because if we are signing onto the Paris Accord, we have to definitely take air pollution very, very seriously. We will also try to examine not only the ambient or outdoor air pollution, we will also try to examine clean air and the built environment, because we will all tend to agree that the buildings and the building design with respect to the climate within the Caribbean is very challenging with respect to the heat cooling, or rather the cooling demand that exists, and then the different challenges that are posed with relation to mold, with relation to sick buildings, etc. So this is going to be another critical component of the proposal. Now, it is estimated by the World Health Organization that 7 million persons die every year due to air pollution. And of those 7 million, 3.8 deaths are attributed to indoor air pollution. And we do have a number of other initiatives that will be detailed in the actual proposal, and we will definitely make this available to all and sundry. And so I just want to thank you all for bearing with me, but I thought that context was going to be important. As we now turn to the panelists, I would invite Ms. Jiselle Joseph from the island of Trinidad and Tobago to do her presentation. Go ahead, Ms. Joseph, sorry.
Okay, thank you very much, Dr. Douglas. If you would just allow me a moment for me to share my screen. Okay. So I will be presenting today based on the country situation for Trinidad and Tobago with respect to ambient air quality monitoring. I'll provide some details on the ambient air quality monitoring network that we currently have in place, and just briefly discuss some of the trends that we would have observed in the monitoring data that we've collected so far. I'll also touch a little bit on a couple of projects that we have been working on with respect to air quality, and just finally outline some of the future plans that we have with respect to air quality. So the ambient air quality monitoring network that we have established is really in support of the mandate of the Environmental Management Authority that is set out by the overarching piece of legislation, which is the Environmental Management Act. That act also provides for the establishment of a national environmental policy, which includes requirements for air quality management, as well as subsidiary legislation, which includes the air pollution rules. And those pieces of legislation have specific requirements which having that ambient air quality monitoring network will support. It also allows us as the government to meet any commitments that we would have identified based on the UN Sustainable Development Goals related to air quality. The main objectives of that network is to assess the extent of air pollution, as well as to provide information on air quality trends, report indices, and collect data that we can use in modeling. We also use the information to support the revision of air quality standards, which we are currently doing at the moment. We also will use that information to evaluate the effectiveness of the land use planning with respect to air quality and effectiveness of emission control strategies. And we continue to use the information to support the conduct of research as well as other studies as they permit. Currently, our ambient air quality monitoring network consists of 4 stations. These stations would have been cited based on criteria set by the US EPA for probe and monitoring path siting for ambient air quality monitoring. And the main criteria would look at things like population density, location of your pollution sources, location of your sensitive receptors, such as schools and other hospitals, old age homes, etc., that can be significantly impacted based on air quality. We have currently 4 stations, 3 located in Trinidad and 1 located in Tobago. And if you look at the map, you will see the exact locations in relation to the geography of the country. Those who are familiar would know that most of the populated areas are located on the western end of both islands. We do intend to expand the network, hopefully to have eventually a total of 10 ambient air quality monitoring stations. The stations are equipped to monitor the 6 criteria pollutants that are set out by the US EPA. These include particulate matter, both PM10 and PM2.5, carbon monoxide, nitrogen dioxide, sulfur dioxide, and ozone. It also provides for the collecting of meteorological data, including temperature, relative humidity, barometric pressure, wind speed, and wind direction, which is of course important as the meteorological conditions will influence the behavior and the concentration of pollutants in the ambient environment. So our equipment, we have 2 types currently. There's the one located in Tobago, which you will see in the picture on the upper left corner, is more of a traditional walk-in shelter, when we initially envisioned the design for the station, we were looking at another location where we would have had potentially impacts due to sea spray. So we wanted something a little bit more robust to withstand that type of bombardment. But the analyzers are more or less the same in terms of the capability for measuring the different pollutants. The one on your right is the most recent one we purchased and is located in San Fernando. It's a very compact model, contains all of the same analytical analyzers for the different pollutants. It also at the top, if you notice, has the probes that would help with the collection of meteorological data. We more lean towards the side of small footprint in terms of the selection of equipment because it makes it easier for siting. It opens up a lot more in terms of potential sites for location of the station. We also look at remote connectivity because of the fact that we have an ambient air quality management information system that is used to generate an air quality index. And it is critical that we have that remote connectivity that will help to incorporate that data in real time for calculation of the index. The analyzers for the station conform to the international reference methods. And this is critical for us as a regulator because this is important if you are monitoring for compliance with regulatory standards. The list of the different methods are included here. And all of these methods are more or less similar and included in each of these stations. The reference methods that we utilize are the US EPA reference methods or federal equivalent methods for the different parameters. So all parameters comply with this minimum requirement. The EMA is also involved in reporting an air quality index. That air quality index is a numerical value that is assigned to give an indication of not just the extent of the air pollution, but also the health impacts associated. It is usually calculated using the actual concentrations as well as other factors in coming up with that value between 0 to 500. So the scale is 0 to 500 and it is categorized into 6 different categories. The first category, of course, is good from 0 to 50. And for this category, of course, air quality is considered satisfactory and poses little to no risk to the population. The moderate category is also considered acceptable, mainly because this is the point at which, based on the calculation of the index, the standard set by the air pollution rules are met. But we do recognize that at this level, there may be some concerns for persons who are unusually sensitive to air pollution. The other categories increase in terms of severity, with the largest category being hazardous, where you record anything over 300 on the scale. And these will result in health warnings in terms of things to adhere to for the population. On this page, you will see just a snapshot of the website that reports the AQI. The AQI is available to the public to view in real time. It allows not only for real-time tracking of the AQI, but it also allows you to check for historical data in terms of the AQI recorded over the period of time that we've been collecting data. So if you look at the top, you would see an opportunity to select the year, month, and day, and it will bring up the actual AQI recorded. You're also able to view the health effects as well as the actual AQI for each of the parameters monitored. What you're looking at is AQI reported based on PM10, and how it works is it would usually show the AQI with the most concern. So the highest AQI value measured at that particular station will be shown. It doesn't mean that it hasn't calculated the AQI for the other parameters. You would just need to, dig a little deeper to see those. But the critical thing is reporting the AQI in relation to the parameter of most concern. And if you want to view the AQI, you can go to the website, that is ei.weblakes.com/rttpublic, to view and go through to see what it presents for the different stations. In terms of data trends observed over the years in monitoring for ambient air quality, and this would have been from 2015 to date for the current network, we have noted, based on the concentrations measured, that the ambient air quality for the country is considered acceptable. We do get the exceedance of particulate matter, which is attributable to the Saharan dust events. This is also reflected in the AQI values that have been recorded. Of course, the exceedances being recorded for Saharan dust events. We also observed trends that can be linked to traffic congestion. So we observed for PM as well as nitrogen dioxide increased concentrations between the period 6:30 a.m. to 9:30 a.m. Equivalent increases we observed as well during the afternoon periods, where we experienced the most traffic congestion. We have two stations that are actually located in that are actually located in close proximity to major arteries entering the various cities. So the data we collect would give a good indication of the linkages with vehicular emissions. We would also observe that PM10 concentrations are usually higher on a weekday than on the weekend. Of course, again, linked to the human-related activities being more increased during the week. And on the weekends, based on the concentrations of, measured, we would also have observed increased levels from the period 11 a.m. to 4 p.m. as well as 6 to 8 p.m., which generally correlates with the traffic activities and weekend activities of persons. One of the major contributors to air pollution currently being measured in Trinidad is Saharan dust events. And it usually typically causes exceedances of the standards, that is the air pollution rule standards for PM10 and PM2.5. Last year, we would have had the most significant event in years occurring on June 21st. And the satellite image shown is a snapshot of that Saharan dust event as it made its approach to the Caribbean. During that event, we recorded an AQI value of 485. And if you compare that to the scale that I would have previously discussed, 485 is close to the actual limit of the scale of 500. So that gives you an indication of just how high the dust levels were on that day. We also noted, based on some data analysis that was done by Dr. Prospero of the University of Miami, he would have collaborated with us to analyze the data during the event, and his analysis determined that the PM2.5 and PM10 ratio decreases as the dust concentration increases. We also try to, develop and implement projects in relation to air quality. There are two projects we're currently working on. The first one is an analysis of the dust collected on the BAM filter tape. That is the filter tape used to collect for measurement of particulate matter in the analyzers of the station. And that project was really triggered when we would have removed the tape after the event, the June 21st event, and observed that the dust collected was a very bright orange color, which was unusual, as the typical color that you would usually see is more of a dark brown to black color in terms of dust collected. We partnered with the University of the West Indies to collect samples from the filter tape to do analysis for metals. 17 filter tape samples were collected. 6 were collected for non-Saharan dust event days, and 11 were collected for the Saharan dust event days between the period of April to June in 2020. And they were analyzed for 11 different elements. Only 5 of these were observed on the June 21st event. We recorded the highest levels of lead in the samples that were analyzed. And further analysis is planned in collaboration with the university as we continue with this project. Another project that we are working on is the preparation of a vehicular emissions paper, which is essentially to analyze data from based on ambient air quality monitoring conducted at a specific location to link with vehicular emissions and any potential health effects associated with those emissions. Baseline emissions would have been established for PM10, nitrogen dioxide, and ozone for the Point Lisas area, which is the focus of the study, and metal analysis that was done through the BAM filter tape analysis project was used to compare with published studies that identify metal markers specific to vehicular emissions, so that it would have been used to help link the fact that the emissions being recorded are actually associated with the vehicular emissions associated in that area, experienced in that area. We also looked at the hourly concentrations for nitrogen oxide, nitrogen dioxide, and NOx and ozone to determine the relationship with meteorological parameters and the time of day. And of course, this is important based on the chemical reactions that occur, one of which involves the conversion of NOx to ozone based on the influence of the sun. We also observe those trends as well based on initial assessment of the data. Data was also compared with not only our standards, but as well the WHO air quality guidelines to identify any potential health concerns and any particular need for amendment of any of our standards. This paper is being finalized and more details will be available once it is ready to be published. Finally, in terms of future plans, we intend to continue expansion of the network. Obviously, this will be dependent on the availability of resources and funding. As indicated previously, we hope to have eventually a network of 10 stations. We are currently in the process of establishing the 5th station, with hopefully a 6th station to also come later in the year. We also are in the process of reviewing with view to amendment of the air pollution rules, which will include a review of the existing standards for amendment. And of course, these are going to be done in terms of consideration of the WHO guidelines and any other criteria that need to be considered in amendment of these standards. We are also in the process of developing an air pollution inventory, and also there are plans to start modeling airsheds for the country. This is going to be done based on the air quality management information system that we've established. We recently purchased additional models to facilitate these activities, and we're currently in the process of initiating the population of the inventory. So those are things that we are also working on, which we consider to be very important in furthering the mandate of the organization. And finally, we intend to continue collaboration with stakeholders. We currently have regular interactions with PAHO, and we are currently working on a joint project for which we received grant funding from the Climate and Clean Air Coalition. It will involve aspects that include the estimation of the air pollution burden of disease, developing a roadmap to the country with respect to air pollution management and health-related impacts, as well as essentially it will have a regional component which will allow for training and sharing of knowledge and learnings coming out of the project. So that's something that the rest of the region can look forward to in the coming months as we finalize the project details for implementation. We also have established memoranda of understanding with key stakeholders, one of which is the Ministry of Health, because we do anticipate that this is critical to us in terms of conducting research and further projects to link the impacts of air pollution on public health. Thank you very much.
Thank you very much, Ms. Joseph, for a wonderful presentation, quite engaging. Who knew the color of Sahara dust could be an indicator for the differences in composition of the dust? So I am thankful to you for that presentation and for all the information. I know there may be some questions the audience may have, but you can just leave them in the Q&A box. We have some other presentations to come. I would just ask that the other presenters try to keep the presentation. I know there's a lot of information that you want to share, just to try to keep the presentations at around 10 to 15 minutes. This is to allow further discourse afterwards so that we don't run over time. So thank you very much. And I would invite Ms. Tashana Redmond from Guyana to commence her presentation.
Okay, good afternoon, colleagues of the panel, moderator, and attendees. I'd like to thank the Center of Biosecurity for another opportunity to share on this most critical issue of air quality. I saw a quote from Li Bingbing of China that wrote, "Air pollution is my biggest concern. Living in Beijing with such severe challenges due to bad air quality has affected our daily lives and health. I do not go outdoors because of it." Such a state of affairs is generally uncommon to the people of our region. We are accustomed to clean, fresh air most of the times. This past year has taught us that being able to breathe clean air is a luxury we can ill afford to lose. While forced to wear masks to reduce the spread of the COVID-19 virus, many have taken their masks off for a gasp of fresh air. But what happens when the mask is worn because of extremely poor air quality? Where then do we get the fresh air? Given the importance of good air quality to sustaining life, nations must develop legislative and other tools to effectively manage the national air quality. The management of Guyana's air quality is outlined in the Environmental Protection Air Quality Regulations of 2000, which was developed under the Environmental Protection Act of 1996. The regulation requires that any facility that is or will be emitting air contaminants apply to the Environmental Protection Agency for environmental authorization. Applications are submitted from a wide array of facilities annually. Dependent on the nature and scale of the proposed project, an environmental impact assessment may be required. Understanding the nature of the environment or the baseline before project implementation is a key component of an EIA. Ambient air quality monitoring is a requirement for projects where it is anticipated that air contaminants will be emitted into the environment. It is true this means that the agency has been able to access air quality monitoring data. The primary source of air contaminants at many of the facilities permitted by the agency are internal combustion engines, i.e., power generation plants. Mining operations, for example, are often remote and find it necessary to install generation systems to support their operations, while facilities within reach of the local grid may opt for reliable and stable power and use a power generation system also. The State of the Environment Report 2016 indicated that the energy sector is the second largest contributor of greenhouse gas emissions in Guyana. With the startup of the oil and gas industry locally, emissions from hazardous waste treatment facilities is a high priority for the agency as well. Environmental authorizations issued by the agency requires the use of best available technologies to reduce the emissions of air contaminants into the environment. One of the success stories in this regard is a bauxite mining company, which after many years of releasing visible quantities of particulate matter, installed a dust collection system that drastically reduced particulate matter emissions in that community. Facilities permitted by the agency are also required to monitor ambient air at their property boundaries, as well as emissions from their stationary point sources. Permit holders are expected to submit results of their monitoring exercises in their annual reports due each year by March 31st. The agency is currently developing a register to record data submitted and track trends. The regulations mandate the Environmental Protection Agency to establish parameter limits for 9 air contaminants, including carbon monoxide, hydrogen sulfide, and nitrogen and sulfur oxides, among others. Attempts have been made over the years to establish these limits, but this has proven most challenging. The absence of substantial quality data collected locally has prevented continuous development and finalization of a national standard. Permissible limits are an essential component of air quality monitoring and management. Therefore, in the interim, the agency cites standards from the World Health Organization, guidelines for air quality, and the US EPA National Ambient Air Quality Standards. As it relates to stack emission, reference is obtained from the Australian standard. The regulations require the agency to prepare an air pollution index, similar to the one referenced by my colleague from Trinidad. The air pollution index is intended to reduce public exposure to poor air quality. At this point, the agency has not established permanent monitoring stations and does not monitor any of the contaminants captured in Schedule 1 of the regulations. Over the years, much of the agency's monitoring has been in response to public complaints from various sources at a local level. These complaints are generally related to exposure to particulate matter and smoke from sources such as open storage and burning of waste from rice mills and lumber yards, sawmills, and other wood processing facilities. Fumes containing VOCs is a constant complaint investigated at auto body workshops. In such cases, the agency has responded with portable equipment, such as the EPAM 5000, capable of monitoring PM 2.5 and PM 10, while the agency uses the Multi-Ray Pro, which can be equipped with sensors of choice to monitor SOx, NOx, carbon monoxide, and hydrogen sulfide. The collection of reliable and accurate data is a necessary part of the process of data collection. One of the challenges of maintaining data reliability is the calibration of equipment. Equipment sometimes has to be calibrated annually. Calibration is most times done at facilities outside the region. The closest option is often the US. Calibration time often leads to downtime for monitoring, especially when there is only one piece of equipment or the two that you have the same calibration dates. Outsourcing air quality monitoring services is often challenging since the expertise is not readily available in country. Many permitted facilities have obtained the services of regional and international companies to meet their reporting requirements to the agency. COVID-19 added a further strain since experts were unable to easily enter and leave the jurisdiction. As a result of these various challenges, today I'm unable to share with you trends observed from tracking local air quality data. However, what I can share with you today is trends in greenhouse gas emissions post-2004 as captured in the State of the Environment Report 2016. This document was prepared by the Environmental Protection Agency in collaboration with the Ministry of Natural Resources and funded by the United Nations Environment Program. The report noted that Guyana has a high dependence on imported petroleum-based fuel as its primary source of energy. During the period 1990 to 2004, the electricity generating sector was recognized as the main consumer of imported fossil fuel products, resulting in this sector being the largest emitter of carbon dioxide. Post-2004, the transport sector emerged as the largest user of petroleum products, superseding the electricity generating sector by a difference of 5%. This increased demand for fuel is directly linked to significant vehicle imports since 2010. In its 2021 budget.
Excuse me, Mr. Redmond, I just wanted to just make you aware, you just have about two or three more minutes left for your presentation. Yes. I don't mean to rush you, but we want to keep the time.
I'll be up before you know it.
Okay, no problem.
In its 2021 budget, the agency was awarded funds to procure additional air quality monitoring units, and the agency will be moving towards monitoring emissions, particularly in areas where the population is exposed to particulate matter from the open storage of rice husk. Staff are also boosting their capacity in acceptable methods for air quality monitoring and analysis. Guyana remains committed to the use of renewable energy sources. Towards this end, hydropower, solar, as well as wind farms. We are aware of the problems associated with air pollution, and collaboratively, we can work towards improving and sustaining air quality throughout the region. So in closing, I'd like to commend the Center of Biosecurity for the proposed initiative, and I look forward to continued work together. Thank you.
Thank you very much, Mrs. Redmond. And I think you touched on a number of key issues with relation to equipment and the access to equipment and the limitations that are currently present throughout the Caribbean. I want to turn now to Dr. Andrea Seeley to start her presentation. And you can go ahead, Dr. Seeley. We'll also be running a poll, which you will see on your screen that you can take. This will help to give us some information as we go forward. So go ahead, Dr. Seeley.
Okay, good afternoon, everyone. Thank you, Dr. Douglas. Thank you to the Center for Biosecurity Studies for the invitation to share with you this afternoon. And bear with me 1 second while I share my screen. Okay, so good afternoon again. And what I want to do is talk to you about African dust in the Caribbean for a few minutes, give you some insight into the history of dust monitoring in the Caribbean, also how it's monitored, trends, and some of the current initiatives that are going on in terms of the region and in terms of their significance in monitoring and forecasting and disseminating information about the impacts of African dust in our region. So just wanted to leave you with a little bit of takeaway. The takeaway comes first and not at the end of the presentation. Sand and dust storms have become more frequent in this region and other parts of the world. But armed with the knowledge, tools, and resources, we can adapt to and mitigate their impacts. So a little bit of history about monitoring Saharan dust, African dust, globally and in this part of the world. Some of you may or may not be aware that the University of Miami's atmospheric chemistry station, located at Ragged Point, Barbados, is the oldest dust record globally. So it is of significance to desert dust research throughout the world. From about 1965 until the present time, we have been monitoring Saharan dust at that site. Professor Joseph Prospero, now emeritus from the University of Miami, started this work as a graduate student way back in the 60s. The station was originally at Coles Pasture, I believe, and now it is at Ragged Point. You can see on the presentation the station near the end of the cliff at Ragged Point. This is the arrow showing, this arrow is showing where Ragged Point is located on the island. And the picture on the bottom right-hand side gives you a glimpse of what the setup looks like. There is other equipment out there at Ragged Point. So we have the University of Miami dust sampler at Ragged Point. We also have the Max Planck Institute for Chemistry. They have an instrument called an EDM, and that measures particulate matter. And of course, PM1, 2.5, and 10 are the kinds of sizes of particulate matter that are extremely important for air quality. There's also a NASA AeroNet sun photometer that measures something called aerosol optical depth, which also gives an indication of how dusty the atmosphere is. At Deebles Point, which is just a kilometer south of Ragged Point, the Max Planck Institute for Meteorology, they have an observatory, Barbados Cloud Observatory, with lots of atmospheric science instruments, meteorological, radar, etc. But there is also a LiDAR at Deebles Point, and LiDAR can also detect dust incursions, and it does a vertical profile of the atmosphere. So there's a lot going on in terms of on the east side of the island. I'll tell you a little bit more about the other measurements we have across the region in terms of people who we collaborate with in our networks. So a little bit about the trends. Now, this graph shows the dust annual means from Professor Prospero's work and from the data collected at Ragged Point from 1965 to about 2008. And basically, the conclusion that has been reached based on the data and the observations throughout this time from 1965 onward is that dust transport had made a jump and increased significantly from the 60s to the 80s. But from the late 80s, it has stabilized. Still high, but has stabilized at moderate to moderately high levels since then. And what else is also very interesting and within the context of this panel discussion, looking at air quality, is that Professor Prospero has done this work and others, but he's a pioneer in terms of dust research. And he has shown not only in this graph where I'm showing 2012 data, but data from before, where Saharan dust is composed of a decent percentage of PM 2.5 particles, but a significant percentage of PM 10. So this 2012 graph actually shows the data from about January to late October of dust concentration. And you would notice that with you notice the line, this line is the WHO, the World Health Organization's guidelines for PM10. You would notice that when you have significant dust events, the concentrations of particles exceed the PM10 guidelines for the World Health Organization. So there is evidence to show that these significant dust incursions do degrade the air quality, and you will get exceedances of the WHO, PM 2.5 and PM 10 guidelines. Now, what is also going on in terms of the region, there are other ways we can monitor dust. We have our in situ instruments where I mentioned the samplers, etc. You also have remote sensing such as satellite data. And of course, you just observe with the naked eye as well, because the dust, especially the significant events, would affect visibility. This satellite imagery and picture that's taken from just above what we call the Bussa Roundabout in Barbados, that's in St. Michael. You would notice that during the significant dust event we had in the Greater Caribbean region last June, and this will be from 22nd of June last year, you would notice that we had this significant dust event. It was actually historic in terms of dust events or dust coming across the Atlantic Ocean to the Greater Caribbean region. The concentrations of dust and particulate matter recorded were the highest recorded in decades. And we would notice that the satellite imagery, and there are other types of satellite imagery can be used, but this is geocolor. It's very useful for monitoring these dust events as well. So these are some of the tools that are there that can be used in terms of monitoring. Another good tool to use would be a model. Now, this is an example of one model, and this is the CIMH WRF, we call WRF or WRF Chem. And we put out forecasts for dust concentration, aerosol optical depth, PM 2.5, and PM 10 concentration. These graphics that you see here, these clips are for the CIMH WRF Chem forecast for those parameters, the dust, AOD, PM 2.5, and PM 10. This forecast would have been initialized June 18th, 2020. So this forecast would have been one of the forecasts that would include the time period of that historic dust event. And you would see that you have a large, significant plume of dust coming across the Atlantic. And your numbers or your concentrations of PM 2.5 and PM 10 actually match those increased levels of dust that we see coming across the Atlantic during that historic dust event last year. The CIMH WRF Chem and other models that are used in the region accurately predicted at least the onset, maybe not the concentration, depending on where the concentrations were measured, but accurately predicted the timing and the significance of that dust event 5 to 7 days in advance. Now, I want to tell you a bit about the initiatives that are very important in the region in terms of sun and dust storms, in terms of monitoring and forecasting. Now, I wear a couple of hats, but one of the most important ones and keeps me rather busy is being the chair for the Pan American Regional Steering Group of the World Meteorological Organization's Sun and Dust Storm Warning, Advisory, and Assessment System, which we call SDS-WAS. And the main objectives of the SDS-WAS are to establish a coordinated global network of sun and dust storm research and forecasting centers, and also to enhance the ability of countries to deliver these forecasts in a timely manner and of high quality as well, to also make observations and to disseminate information and knowledge to users through an international partnership of communities doing both research and in terms of the operational services. There are 3 regions under this initiative: the Regional Center for Asia, which is hosted by the Chinese Meteorological Agency; the Regional Center for Northern Africa, the Middle East, and Europe, hosted by the Spanish Meteorological Agency and the Barcelona Supercomputing Center; and then the Regional Center for the Americas, which is hosted by us at CIMH here in Barbados. Then there are 2 operational centers that are hosted in Barcelona and Beijing, and we hope that we can host a 3rd operational center in the next few years or so. Basically, an operational center would be round-the-clock dust forecasting in a real-time sense, in terms of giving you forecasts, to give you early warning, or even in seasonal, in some instances, medium-term forecasting for sun and dust storms. Another initiative that is very important in the region, and it is a subgrouping within this Pan-American region, a very active group called the Caribbean Aerosol Health Network. And this group is a coordination of a number of groups, including ourselves at CMH, Professor Olga Mayol at the University of Puerto Rico, Professor Emeritus Joseph Prospero that I mentioned earlier, are two of the coordinators of this Caribbean Aerosol Health Network. And there are a number of us in the greater Caribbean region who are looking at the impacts of aerosol, well, air quality on health, but air quality focusing on Saharan dust and how that impacts the air quality. And one of the significant activities that is ongoing is the Caribbean Air Quality Alert and Management Assistance System, Public Health, Kalima PH it's called, and this has a summer intensive field campaign that we participated in last year, and we will be participating in again this year. This looks at the Saharan dust from a holistic perspective in terms of monitoring, the measurements, and the forecast. And this is looking at improving the forecast so that we can have more improved or develop improved early warning systems for sand and dust storms, or for Saharan dust in this case. The CIMH aerosols and dust team, we actually produced daily weather and dust briefings last year, and we plan to do that again this summer. So these are some very important initiatives. There are other things going on as well. Some of the collaborators that we work with in terms of measurements and observation would be our colleagues in Puerto Rico, who also measure aerosol optical depth. They measure particulate matter and dust. Martinique and Guadeloupe also measure particulate matter. We have a group in Merida, Mexico, on the Yucatan Peninsula. They measure particulate matter and dust as well. And Cayenne, French Guyana, also measure PM and dust. And we are hoping to collaborate with other colleagues, even including in Trinidad and Tobago, because we really need to have a sense of who's doing what in terms of the monitoring and how we can work together in terms of looking at the Saharan dust and other aerosols and the impact on air quality within the region. So that is my my brief background in terms of African dust in the Caribbean. And I look forward to engaging with you more this afternoon with the discussion that's going to follow these panelist presentations. Thank you.
Thank you very much, Dr. Seeley, for a very thought-provoking and insightful presentation of all the good works and the different networks as well that are currently existing. We hope that we can definitely tap into those networks and build out a regional effort that will redound to the benefit of all in the Caribbean. Now we want to turn our attention to Miss Leanna Chapman from the EPD, the Environmental Protection Department here in Barbados. I will turn over the floor to you, Ms. Chapman. You have the floor.
Hi, good afternoon. Good afternoon to you, the host, Mr. Douglas, fellow panelists and attendees, and now allow me just a brief moment to share my screen. Hi, everyone can see, someone can verify I'm new to this and can see the screen?
Yes, yes, we can.
All right, thank you. All right, thank you. As I said, my name is, or as I was introduced, my name is Miss Chapman, Miss Leanda Chapman. I'm the Senior Environmental Technician at EPD, that's the Environmental Protection Department in Barbados. And I'm just going to give a very brief introduction into some of the air quality management that is being done in Barbados. Currently, we don't have a comprehensive ambient air quality legislation or set of laws or regulations, but we do have some existing laws that are used to handle ambient air quality issues. The most prominent or the most prevalent, most often used is the Health Services Act, Cap 44, specifically the nuisances regulation. But at times we may have to engage other departments to assist by using their acts, for example, the Town Country Planning Act or the Customs Act. or any other act that that may be able to help address the issue, because there's no comprehensive legislation. With respect to monitoring, we have done passive monitoring studies using diffusion tubes in the past. So like on the left, what you see is a picture of our the study, one of the studies. I can't remember which town this was, but basically each of those tubes, there's no pump, but it just draws air. The air goes into the tube, and every 30 days, we would go take down the sampler, package it, and send it to overseas for analysis, while replacing it with a new sampler. So to swap out every 30 days and send the ones that were up overseas for analysis. The tubes monitored for SOx, that's sulfur oxides, nitrogen oxides, ozone, and VOCs, that's volatile organic compounds. It's not reference method, but it does give you some baseline information and preliminary identification of hotspots. We did this in our 4 major towns in Barbados. Each town was studied for a year, and that was Bridgetown, Holetown, Oistins, and Spikestown. This project started in 2012, so I think Bridgetown was first for 2012, and then Holetown might have been 2013, 2014, going on down the road. The project is now completed, but we do have some preliminary data with respect to monthly trends, I guess you would say, in the 4 major towns. Barbados is also part of the GAPS project, which is a global atmospheric passive sampling project. So other countries involved are like Mexico. I've seen Mexico, North America, Europe, various countries, and the samplers are deployed at Ragged Point, similar to what my colleague Andrea showed the picture of Ragged Point in Barbados. These 2 samplers are also at that location. So the first one at the top that collects POPs, collects information on POPs, that's persistent organic pollutants. The silver one at the top, and recently they've added mercury, which is the blue one at the bottom. So actually there are 3 samplers up there usually for mercury. At any one point in time, there's an ongoing study which we do with Canada, out of the Environment of Canada. These samples are not changed monthly, but quarterly. So every quarter we'd swap them out and send them overseas for analysis while putting up new ones. On to something a bit more recent. More recently, we have done some active monitoring. So basically there's a pump involved. The equipment you can see there on the left with a solar panel. Air is drawn into the sampler, and it monitors for particulates, PM10 and 2.5, SOx, the sulfur oxides, nitrogen oxides, ozone, and carbon monoxide. And the equipment provides trends on the various pollutants that I would have just mentioned. We currently have 3 of them. One is at CIMH, that's the Caribbean Institute of Meteorology and Hydrology. That one is active and currently reporting. Treasury Building, that one is currently active also. That's in Bridgetown, our central town. And one at Darcy Scott roundabout. That's in Warrens, commonly in Barbados known as the Simpson Waters roundabout. So we have those 3 locations. The one at Darcy Scott was operating up to March of this year, but it needs a part which has been delivered to the island recently. So that one should be back up and running hopefully shortly. So there's an ongoing project. It recently started. There's not a wealth of historical data, but it's a pilot project. And so far there have been teething problems, but we've gone ahead and sorted out and we continue. This here is just a snapshot of the kind of data we would have gotten from the CIMH location. We have as I said, we have a station at CIMH, and this is some of the information we would have gotten from one of the units that I would have shown you in the picture. So we saw so here in this region, this is pre anything. Or what we would consider so far. We have limited data that looks like what we've seen to be typical levels. And then around the 6th, 7th, I think it's the 7th and 8th, we saw an increase, but the volcano hadn't erupted as yet. But we had understood that there was Saharan dust, so we attribute that increase there on the 7th and the 8th to possibly being Saharan dust. After the 8th, now on the 9th, when it did erupt, we would possibly attribute this increase with the red thing most likely to the volcanic emissions, an addition which may be superimposed on the Saharan dust. So in this area here, it's even more elevated, and we attribute it to 2 of those factors at this point in time. After about the 14th, 15th, we saw that it started to come back down to what I said we have limited information, but what seems to be pre-volcanic levels. So it just gives you an idea of the trends. And that's just a sample of the type of data we hope that we'll be able to continually get from this type of equipment while recognizing it's indicative, and that we would like to have reference method equipment to have more concrete data. These are just some of the other committees and policies that Barbados would have been or is involved in that have an impact on air quality. There's the Climate Change Committee, the Ozone Steering Committee. There's a Barbados National Energy Policy 2019 to 2030. I know the host mentioned this in his presentation or introduction. Implementation plan for the Barbados National Energy Policy. There is Electric Light and Power Act, where renewable energy is encouraged and is allows persons to sell energy into the grid, renewable energy that is, the Public Project Smart Energy Program, the Global Climate Change Alliance Project, the many different projects that Barbados, these are just some of them, would be involved with, not necessarily under EPD, but some are under EPD, some are EPD involved, that would assist with air quality management in Barbados. And lastly, I kept it short, areas that I can see right now for improvement. Equipment or monitoring network. Yes, we started and we've had some indicative equipment, but the truth is that reference method equipment is essential to be able to accurately monitor or measure the air pollutants. Further training, whether it be in air quality management, air sampling, or modeling is required. Enhanced lab capacity. We have attempted to do gravimetric samples in the past. And one of the issues that we faced is that you don't have a 6-point balance here, and a sensitive enough balance, and it has to be sent overseas for analysis, which, it would have been easier if, and more timely in terms of the lead time or the lag time to get results. It would be easier if something like that were available in Barbados. And also we would want another area for improvement would be a comprehensive legislation which speaks to ambient air quality. And that therefore is my presentation. I kept it very short. I want to thank you for listening. Once again, Leander Chapman, Senior Environmental Technician on behalf of the Ministry of Environment and National Beautification, Government of Barbados. And I also want to join with some of the other panelists in saying I commend this initiative, and I'm grateful that it is around because I think it can assist in predictions as well as interpretation of observations. So thank you for having me, and that's it. Thank you.
Thank you very much, Ms. Chapman, for a very intriguing presentation. I really took to liking the graph that you showed. However, the only thing that I would have perhaps liked to see would have been the WHO limit and perhaps a gauge of the quantitative measure for the particulate matter to give some idea of the reference, even though we understand it's not really official data because of the lack of reference equipment. It would still be interesting to view that with those two things in. But I really thank you for contributing to the discussions, and we look forward now to the panel discussion, which will be a brief, which then will be followed by the question and answer section. And I see there are a number of questions in the question and answer box. And so I'll just like to invite the panelists to just turn on their videos and turn on their microphones as I go in a short round robin fashion just to pose two short questions to give some more depth and detail. So the first question is, what are some key elements that are still missing from the fight against air pollution in the Caribbean? And I will start with Ms. Jiselle Jota. I'll start with you since you went first last time.
Okay. Thank you, Dr. Douglas. I think one of the biggest challenges that we currently have to deal with is the access to resources, which would facilitate so much of the work that we would want to do, as well as the public awareness initiatives, the enforcement and implementation of legislation. We're now actually getting into those things. So we're new into that aspect. And as we start with these activities, there's still a lot of catching up to do to get where we need to be with respect to the needs for air quality management. Certainly, this initiative is very timely because another issue we think is of importance is that collaboration, regional collaboration, which would, bode well for the sharing of data and other items that can be beneficial from one country to another. So I think in terms of the missing elements, definitely access to resources, the health impact assessments in terms of the burden of disease assessments, increased public awareness, and of course, enforcement and implementation of legislation.
Okay, thank you very much. And Ms. Redmond, would you like to weigh in on this? I think your mic is still muted. Yes, she may not be there at the moment. I'll turn over then to you, Dr. Seeley. Would you be so kind to weigh in here for us?
Sure. I'm going to weigh in not as a regulatory person because I'm with CMH. Everyone else is with their respective governments, but definitely from the perspective of what we are trying to do in terms of Saharan dust and air quality, more samplers, a more robust network in terms of what we have in the Caribbean, because it seems like in terms of the air quality monitoring, in terms of the instrumentation that's out there, it still seems like we might be few and far between. So it would be really good if we were able to get samplers in more islands. And you can start low cost at first, but it would be really nice if we could get more reference. And the regulatory people are really more familiar with this, but the reference method type quality samplers in the region, so we could have a robust network. Because really and truly, if you want to look at enforcement of legislation, if you want to look at trends properly, all those things that are going to come with early warning systems and environmental management, you need that instrumentation in there. And then, of course, we have that, but I agree with Ms. Joseph, definitely the collaboration. On that note, I'll be confusing her a little bit because I wanted to get some data from Trinidad. So I'm putting you on warning now. But yes, we definitely need to collaborate because we're small, and when we come together, we can do a lot of great things. So definitely the network, the collaboration is needed. A good quality, robust network and collaboration is needed. That's it from my end.
Excellent. Thank you very much, Dr. Seeley. Leander, would you like to weigh in here?
Well, basically funding is something that's very needed. No matter what you've determined that you're going to do with the funds, that is typically a stumbling block. But if I had the funds, what I would want would be, as I would have indicated in the presentation, and also Miss Andrea would have just stated, we need a much more robust monitoring network. In addition to the indicative, to help with spatial analysis, but you would also need reference method equipment in there, similar to what Trinidad has, which would really assist in being able to, let's say, get robust data. That's the best way to put it, robust data, and also training in the adequate training in the adequate use of the data, analysis of the data. And the last thing I would want is legislation. But I guess that comes from each country and not necessarily. But I also wondered, you've got things like World Health would give out guidelines for a region, and then each region might tailor it. And if something like that is not necessarily saying that we are World Health, but you know, that sort of look at air quality from a regional perspective, which individual countries can then take and tailor make if they want to their region. So those are three things. Well, four: funding, equipment, training, and legislation. Those are the things that I think would be useful.
Well, thank you very much, Ms. Chapman. I think you've hit the nail dead center on the head, and also the other panelists. And I would submit to you that, yes, funding is a predominant challenge for us in the Caribbean. However, I also want to add that there is light at the end of the tunnel, and there are some avenues for funding. And that is where I think the Center for Biosecurity Studies will play a major role in trying to coordinate the efforts around the region to be able to access funding. One of the key strategies that we can apply, and this can go on a country by country basis, so it necessarily wouldn't be one large project, but you can do for each individual country to build out a project that would help to build your capacity for monitoring. And I know that these pieces of equipment are quite costly. And so that capital investment is one of the major hindrances for establishing proper air quality monitoring throughout the region. But again, I said, once we can link that to climate change, I'm sure that we can be able to increase our possibility of acquiring funding. So stay tuned for more on that, and we will be in contact with you. And we will try to work together with each country to see how we can chart a way forward with respect to that. I also want to commend you all for the hard work that you're doing across the region. We know that it's very challenging, resource limited conditions, and trying to do what is necessary, but not having all of the necessary tools. So kudos to you all. Continue to do a great job that you have been doing, and stay focused. There's help on the way, and we hope that it will come sooner rather than later. Now I will turn over to the question and answer and see if we can answer a few questions from the participants. And thank you for your patience for all the attendees so far. The first question is from Mr. Eric Concepcion, and this is directed to Ms. Joseph, and there are quite a number that were directed to Ms. Joseph after her talk. PM 2.5 and PM 10 continuous monitoring are equivalent methods. In order to quality control, you apply some reference methods to compare. So I guess the question is relating to the continuous monitoring of PM 2.5 and PM 10 and how you can establish quality control. And this is to you, Ms. Joseph.
Yes. I hope that I'm answering the actual question. I was a little bit confused, but I will attempt based on what I understand from what he's asking. Yes, the PM 2.5 and PM 10 are equivalent methods. In terms of QA/QC, no, we don't use reference methods at this point for quality control. I know that we do have a few limitations with respect to the QA/QC that is normally required for the type of analyzer, that is the BAM 1020 analyzers. And it's something that we are working on. But in terms of conducting reference methods for comparison in terms of quality control, no, we currently don't do that.
Okay, thank you very much. The next question comes from, I'm not sure if this is Miss or Mr., but Jody Marston. Ms. Joseph, on June the 21st, 2020, when you recorded an AQI index of 485, did Trinidad experience any increased reports of health effects?
I can't definitively state because we don't have the data to confirm. We can only guess that there would have been based on the significant levels and the fact that the AQI actually associates that level with significant health impacts. But in terms of having the data to corroborate, no, we haven't examined that data at this point to corroborate. That's something that will probably be looked at in future as we leverage on that memoranda of understanding that we've established with the Ministry of Health very recently. That will allow us to examine some of the data that they may have available. So I'm sorry, but I can't give you a definitive answer for that.
Okay, no problem. Thank you. And there's another question for you, Ms. Joseph. And this comes from Ms. Caroline Blendman, who is a partner with the Center for Biosecurity Studies. She's a green economist. And she asks, thanks for the informative presentation on initiatives to address air quality in Trinidad and Tobago. Kindly advise if the air quality indices, 6 categories ranging from good, moderate, unhealthy, unhealthy, very unhealthy, and hazardous that you mentioned during your presentation are nationally or internationally derived?
The AQI calculation is a standard calculation that is utilized internationally, and we adopt that same calculation. There's only one slight adjustment, and that is the use of our standard. So our air quality standards are used in the calculation, but the method itself is the standard international method used for calculating and reporting AQI.
Okay, so your standard that you utilize in Trinidad and Tobago, that
Yes.
is directed from the WHO?
Some of it would have been incorporated, but again, the standards would have taken several things into consideration. So it's not just the WHO, some of them would have, the WHO guidelines would have had some input, but there's also other aspects that are taken into consideration in terms of the ability of persons to meet the standards currently at the time when the standards were derived. And other things related to environmental management. And that is one of the reasons why we are currently looking at revision of the standards, because we do recognize that there is a need to bring them more in close alignment with the WHO health guidelines, which are essentially guidelines and not necessarily standards.
Okay, agreed. And thank you very much. On to the next question from Ms. Fiona Lewis. In addition, this is more of a comment rather, in addition to the elemental analyses of Saharan dust in June 2020, Jamaica also conducted microbiological analyses. The microbiological assessment of the air quality samples revealed heavy bacterial growth. The most abundant bacterial species identified were Bacillus subtilis, Escherichia species, and Acinetobacter species. Based on the information from our Ministry of Health, the microbiological constituents of the dust were not likely to directly cause diseases. Thank you for your comment, Ms. Lewis. And on to Mr. Juan Castillo. And this is for Leander. Hi, Leander. What are the monitors for PM that are being used?
I mean, with respect to the brands, when he says that they're indicative. Hello?
Hello? Yeah, I think the person perhaps is thinking of, because you mentioned that they were passive
The, no, no,
monitors. Are for PM? You don't use passive ones?
no, no. They're
Okay,
all active. They're all active.
they're
So
all active.
they're all active samplers. In the past, we would have used for the gaseous ones, the SOx, NOx, VOCs. We had passive sampling project done years ago, which started and completed in the towns. Right now, I assume any person is referring to the active ones. And we use, I'm not sure what the question is asking. It basically draws air in, takes a sample, and is there sensors, the electrochemical sensors? I don't know if that's what the person means. They're basically electrochemical sensors and laser technology being used for the dust and sensors for the gaseous components.
Okay. Thank you very much. I hope that answers your question, Mr. Castillo. And Ms. Lewis, she has a question, and this time is directed towards me. Dr. Douglas, you mentioned the need to examine air pollution legislation across the region to, among other things, identify gaps. Has a timeline been set for this? Jamaica is at this time embarking on a technical review of our air quality regulations with the aim of closing the gaps identified. So this initiative would be beneficial in the strengthening of our legislation. To answer your question, Ms. Lewis, we don't necessarily have a strict timeline at the moment. The reason for that is we have another initiative that we're currently engaging on in terms of the Caribbean Wildlife Initiative, and we're currently undergoing a legislative review of Caribbean wildlife legislation. And I'm hopeful that a similar team can be compiled to effectively do this. All of this work has been done pro bono from professionals across the Caribbean. And so it is challenging to get persons together to work on this type of initiative. So it takes some time. But be rest assured that this is something that is definitely high on our agenda, and we will try and endeavor to get this done as quickly as we can. So thank you very much for your comment, and we will be reaching out to Jamaica to find out, what legislation you have. We've worked already with NEPA in Jamaica, and we hope to work again with you guys in the future. On to the next question is from Mr. Dave Scantlebury. How far in terms of time are we from having a publicly disseminated early warning system? Sahara dust is my big trigger. Sorry to hear that, Dave. I guess who would be most adept to take this question? Perhaps you, Dr.
I
C.
could, yes, I could
Yes.
probably attempt to answer it.
Okay.
The answer is going to be a little bit loaded, for want of a better term. But in terms of a formal early warning system, I would have mentioned that there are a couple of initiatives that are we are working on that in terms of a formal early warning system. I would say that we are a matter of months to a year or two at most based on these, because these would have been projects that were, well, one would have been funded by a NASA project, and we're working with some colleagues on this, and they want to strengthen this for the whole region, not just the Americans, even though NASA has funded it, in terms of Puerto Rico, that is. But we can actually also, you have to look at the fact that different countries are going to do different things in terms of early warning. So that's why I said my answer is a little bit loaded, because I know one or two colleagues with their various Met services who are doing something like that already in terms of looking at forecasts and trying to warn the public about degraded air quality levels as a result of Saharan dust episodes, predicted Saharan dust episodes. So, really and truly, in a holistic sense, though, for a formal early warning system, a regional type thing, we're a matter of months away from that. But the information can be publicly disseminated in a format that is a warning system format. It has been disseminated. It's just a matter of how far it's gotten, because we do send information to CARFA and PAHO. I do that for the predictions we put out at CMH, and we ask them to disseminate it to their networks, which will be the health ministries, etc. And then, like I said, there's some Met services that will put out this information based on the model predictions for our Saharan dust episodes. So that's why I said it's loaded. A formal thing, it's not that far away. I should say it's more a medium term or short to medium term goal, but the information can be publicly disseminated in a format that's friendly, because we have the information there and we can get it out to the public as necessary through whatever means or channels we have to. The Met services have access to our forecasts. The forecasts are publicly available, so they can actually go in and use it with their forecasting for weather, etc. So that it can get out there. It can get out there. And what we can do is probably see what the needs are in terms of communication, and if it's getting out there or if it's not getting out there, why isn't it, and work on that. So that's my answer to that for now.
Well, thank you very much for a comprehensive answer. And I hope that answers your question, Dave. Now, on to the next question from Miss Lori Christian. The yellowing of the dust versus the brown, that is most common and normal observation. Wouldn't this yellow color reflect global warming? Who wants to take this?
Do you want me to jump in? The person is asking, let me see if I can.
About the color of the dust.
The color of the dust?
Yeah, and if the yellow color is indicative of global warming or
this is my kind of exposure. Well, I'm an atmospheric scientist by training, so I've been exposed to some atmospheric chemistry. I, at first guess, as an atmospheric scientist, I would say the difference in color has to do with the chemical composition, and also this would be a factor of what has happened during transport. I would like to know, it would be interesting to see, and this is the researcher in me talking now, when do you observe the different colors? Because I will tell you this about the Saharan dust. We get Saharan dust transport changing throughout the season. So the earlier episodes, and this is based on atmospheric circulation and transport, the episodes, dust episodes you get earlier in the year before we get into our main season, like remember how we had all that dust in June? In like February, March, April, you will see the dust going more south. So the Southeastern Caribbean, Northern South America. Later in the season, you're going to see that further north, like how the historic dust episode was by June, the atmospheric transport will bring it full over the Eastern Caribbean, the Northeastern Caribbean, the Northern Caribbean. You see where I'm going with this. So the transport, the source regions also make a difference. So that is what I am thinking. That is my response to that. But in the context of global warming, I am not sure how to address that. But the color to me would be straight off. I would think composition, which would be as a result of those factors I mentioned. But if the person can clarify the question, I might be able to answer it a little better.
Yeah, sure, no problem. And you just raised a very interesting point in terms of the source of the Sahara dust. And the Sahara Desert is quite a vast swath of land mass. I'm just curious, with respect to the monitoring that's done in the Caribbean, is there also like a similar type of monitoring being done on sub-Saharan Africa that perhaps there could be some south to south kind of collaboration, and they will have, I don't know what their capacity is at the moment, but has that been explored to kind of like find out what levels or what quote unquote colors of dust that they would usually see over the course of the year?
Oh, in terms of monitoring on that side of the Atlantic, you're saying? No, there have been some studies done on that side of the Atlantic, and I will tell you for sure from an atmospheric science perspective, in terms of not just the transport, but the chemistry. So offline I could talk more about that as we delve into it. But there has been some work done, and in terms of the chemistry, because I know I've seen some work where they've looked at the chemical composition of the dust from that side of the Atlantic versus what we're getting. We actually have some collaborators we have worked with too who were actually here studying the dust as when it got here to Barbados, and I think they did some work over on the Cape Verde end of things, just off the African coast. So that much I can tell you in terms of the chemical composition, which it would probably more than likely look differently too. In terms of the chemical composition and speciation, that kind of work has been done. And it's still ongoing because there's still a lot of stuff to be done in terms of the dust. So yeah, and on that end, that's what I'm thinking. That may be what the person is trying to find out.
Yes.
But hopefully this helps answer the question.
I hope so too. There are two questions that I actually missed, and I'm now seeing them, sorry. Mr. Simon Boxall, the dust originates from the dried out portion of Lake Chad. The lake has shrunk by over 90% within the last 100 years. Some of this may be linked to climate change. The dust is also a vital nutrient source for the Caribbean coral reefs and even the Amazon forest. So maybe not all dust is bad. There is a reason for it, just like pollen. Pollen has a specific reason for being in the ecosystem for pollination, but it also is a hazard to human health. And in a similar manner, I think volcanic ash and also dust as well play a part in terms of increasing fertility in soils, etc. So point taken, Mr. Boxall.
Yes, they do. Lake Chad is very important historically in terms of the dust we're getting because the lake definitely has shrunk over time. And those of us in the looking at Saharan dust would also know about the Bodele Depression, which is in that region. That's part of that area where you get a lot of our dust. That is the largest or one of the largest dust sources in Northern Africa. Yes.
Wow.
So definitely that comment ties in with things that we've been seeing or things that have been studied. Yes.
Excellent. Thank you very much. One attendee is asking if the webinar will be made available online, and that answer would be yes. We will try to prepare a link for the recording online to be made available to everyone on the call at the moment. Ms. Blendman has another question. Her question is, Dr. Seeley, in your presentation, you made mention of 4 models assessing Sahara dust and different types of particulate matter. On each graphic, the dispersion seems to be increasingly narrow across the mid-Atlantic ridge. Any idea what is the major cause of this, or is it simply a case of alterations in wind currents?
Okay, great. I can answer that. First thing, it was 4 sets of output from the same model. So it would have been output in dust concentration, aerosol optical depth, particulate matter 2.5, and particulate matter 10. And what you see is actually a result of the transport, which would be the direction of your wind currents. Yes.
Interesting. And one thing I noted too with that particular graphic that Ms. Blemon mentioned is that the PM 2.5, I don't know if it's because of the weight of the PM 10 and PM 2.5, but PM 2.5 seemed to move a bit. I don't know if it was faster or it's a slightly different pattern to the PM 10.
Okay. Physically, that does make sense. The mobility of the smaller particles would be higher. Yeah. But that's something that's a good thing to look at too.
Yeah, very, very much so.
In terms of the science behind the atmospheric science and the physics. Yeah.
Correct. And yes, I think we've exhausted. There's one other question I see coming in. Ms. Joseph, is the AQI a live interface for the public? And have you faced any particular challenges with it?
Yes, it is a live interface for the public. It records real-time data in terms of hourly emissions. And in terms of challenges, there's not much challenges that we experience with the AQI. More of the challenges are essentially with any downtime of the stations for recording. So When you go on the AQI website, you will see AQI reported for those stations that are actively connected to the network. You don't see any data being presented. It's maybe because it has been down for maintenance or some other connectivity issue. But the AQI itself, the interface, we've had no issues or challenges. And it is, as indicated, live. You can go on now and check to see what the AQI is now as being measured by the stations.
Well, that's real-time monitoring, which is
Yes.
excellent. So thank you very much for that answer. And we just have, this would be the final question before we wrap up. And this is from Mr. Eric Concepcion, and this is directed to Ms. Chapman. Ms. Chapman, previously to introducing air quality modeling, do you consider also making an inventory emissions? Not sure I quite understand, but
yes, inventory emissions could be a possibility. We have done like POPs inventories at the department, but that was a couple years ago. We've done POPs, and I think an inventory was done on, it was a stock. I can't remember if it was an incinerator or what the stock, because there were some students we had and they did an inventory. I'm sure of the POPs because the POPs were the bigger project, and I think they did inventory also with respect to a particular industry. So it is something that we have done before and could possibly look to the future, yes.
okay, well, thank you very much. And I also see a comment from Mr. Castillo. He was just giving us a general comment, and he's from PAHO, the Pan American Health Organization. He just wants to tell us congratulations for the initiative, and to note that PAHO currently works closely with Trinidad and Tobago, and we will be happy to explore collaboration to support regional efforts. So thank you very much, Mr. Castillo. We definitely will look forward to having some more support for this regional initiative, because I believe there's a lot that we can accomplish collectively as a region. As we put our collective efforts together, we can definitely get a lot more mileage out of it. And I really want to thank all of you who have participated, Ms. Chapman, Ms. Joseph, Dr. Seeley, and also to you, Mrs. Tashana Redmond in Guyana, and also to our support team behind the scenes, Mr. Wesley Moore from CBS, and also from SITS, Mr. Jamal Innes, and also Mr. Samuel Eugene. So on behalf of the Center for Biosecurity Studies and the University of the West Indies Cave Hill Campus, I want to thank you all the participants and also the attendees for joining us for this session. And this would be part one of this session. And we also are in the process of planning a second session that will try to examine the health implications of air quality. And I have it in concept, but I have to flesh it out. And then I will communicate to everyone on that tentative date. And then you can mark it down in your calendar, and hopefully you will be in attendance. To give some idea of a recent development, we've had some communication from a very interesting collaboration with Harvard University. And there's a project called the H3E project here in the Caribbean. And what this particular project looks to do is to combine human heredity, health, and also the environment. So in context, to pull together the genetics, your health, and also the impact of the environment on your health. So please stay tuned for more on this. And I think it's quite exciting for the Caribbean, and hopefully we can definitely get some funding from the NIH on this and make some strides for the region. So thank you once again, and I bid you all a pleasant good afternoon. Take care.